is Gary Deverman. I'm Chief Executive Officer of Building Healthy Communities. And we are an organization that reaches out and helps empower communities to work with their children, families, health practitioners, and other components of the community to take ownership of their health and create a sustainable culture of health in that community. The purpose of building healthy communities is to empower communities to take ownership of their health and to be able to mobilize those assets that they have to create a sustainable culture where health is the default. The key thing for people in communities across the country is to have all people working together in the interest of the health of the community. Every individual needs to realize that they should basically drop the guilt of where they are and say that I am where I am and the future is what's important, and how kind of future is that going to be for myself, my family, my children. And so we want to help them create that culture in the community, and it's there for everyone. There's the leadership and the funding there. It's just we help connect the dots and mobilize that into action. Our national goal is to have communities across the country instinctively know how to come together to address issues. This one happens to be on the overweight obesity issue and its impact on chronic disease prevention, but it could be anything where we were able to help them know how to grab the leadership they need to address an issue, understand how to assess what assets they have to address it, and then move quickly to create a solution. We are working with the regional health administrators. What we do is we talk to the commissioners of health in those communities, the leadership, the public health officials. American Medical Association is one of our partners. We work with the American Medical Association Society in that community, and we bring the core people together to talk about the situation that they're facing. We look and see what assets and what assessments they've done, and based on that we bring together the people to develop their own action plan. And then with that, we then help empower that plan. We have Building a Healthier Chicago, and they now have 200 organizations that are working together toward trying to address the nutrition of the people in Chicago, the physical activity that they do and the opportunities for that, and their own health management, going to the doctor, making sure they're taking the pills that they're supposed to if they're on some. And it's been a tremendous success. And before they weren't working together. Now organizations are talking together. They're looking at a common agenda, and there's a lot of excitement around making Chicago a much more healthier place to live. Washington, D.C. Just became the second city, and that is it's Building a Healthier D.C. And the other cities across the country are cities like Dallas, Memphis, Philadelphia, even rural communities like Des Moines, Iowa. Overweight obesity in Iowa is 73% of the population. So we're looking at both urban settings like Los Angeles and rural settings as well. We have a toolbox that we've created, and we've created it because different communities are at different stages of their awakening on this issue and the things that they need. So we're not there to duplicate or create a bureaucracy. We're there to be an asset for them. And so there's different tools. And so one of the ones that everyone seems to want is the communication and coordination platform. And what that does is it creates a common ground for the organizations that are working in this arena to come together with the mayor's office, public health officials, and really start addressing it as a total community. We put that in, and we get that funded, so there's no cost to the community. It provides the rallying point to get started, and everything else rolls off of that. We have a program in schools. PE is a priority to help get physical education back in the schools if that's an issue. We have a program called Building a Healthier Plate, where we work with restaurants, we work with food service in schools, to create a situation where children particularly and adults as well are going to have more healthy options when they eat. And that is a goal we have nationwide, that no child will be anywhere where they can't get a healthy option to eat. We have been very fortunate to blend both the corporate America and organizations in health and organizations that work in the community. The American Medical Association is a new partner. The American Academy of Pediatrics is a partner. USDA is a partner. Then we have corporations like WellPoint, Glaxo, Abbott, companies that helped found us like Nike and Campbell Soup, and a number, a cross-section of insurers. We have people in the pharmacy world like Super Value Pharmacies, that's your Jewel Oscos and Albertsons. So it's retail and it's education, academics, it's business, all coming together around one thing, and that's to make the community healthier. We are funded now by corporations that have put money into a fund that is directed by the National Roundtable for Obesity Prevention. That fund is seed money to help communities get started, get moving ahead. In addition, we help with resource development and other expertise those communities. Well, we have our website is www.buildinghealthycommunities.org, and so they can start there. Secondly, they can get in touch with us. And what we start doing then is start working with them to see what kind of cohesive group already exists and how we can be a catalyst to move it to the next level. We start in by working with the regional health administrator in that region out of HHS. Then we work with the commissioners of health and start building that entity. If there's a coalition that already exists, we work with that coalition. We do not want to create a new bureaucracy. We do not want to take money from organizations that are already getting money to do this. We want to enhance that or be a catalyst for new resources. Well, the healthcare costs is one of the big costs has been driving our gross, GNP up, and our costs of doing business. So 3 out of 4 dollars spent in healthcare is overweight, obesity, and chronic disease. So if we're able to make this country healthier and have more of a culture of health, the cost of doing business goes down. That helps with the ability to hire more people because you're spending less on healthcare and more on people. And when you have companies like Starbucks and others like that that are spending more on healthcare than they are on coffee beans, or GM more on healthcare than steel to make the cars, there's a problem. And this also is putting great weight on this nation. America needs to become a healthier nation that also help the financial situations and help us move to a better economic time. Well, we hope to have, by the end of this year, 30 communities up and running, at least with the platform. So it's sort of a staging effort. We start with getting people to communicate together, then we start working. We hope to have 10 in a pretty aggressive effort by the end of this year. Then we hope to be up to 50 by the end of the second year and continue from there. Have done other programs like this. It takes about 3 to 5 years to get really rolling and ingrained in that organization, which is called the Safe Kids program, now Safe Kids Worldwide, has 300 communities in the United States that are model communities. And so our goal is to, in the next 3 to 5 years, to have a number similar to that, around 300 communities that are really becoming models of how to create a healthy environment.